today we are going to look at the cerebellar. We're looking at the cerebellar peduncle. So cerebellar peduncle and their connections. So under this, the first questions. So the first question we want to ask is talk about the middle cerebellar peduncle. So we need to know about the afferent fibers. So what are the afferent fibers of this? The second question is what are the afferent fibers? The first second question is in terms of the inferior cerebellar peduncle. In terms of the inferior cerebellar peduncle, what is the afferent fibers? So you're asking what are the afferent fibers of the inferior cerebellar peduncle. The third question is we are asking in terms of the superior cerebellar. So superior cerebellar peduncle. So what is the afferent fibers? So these questions you'll find the answers in this video, and in the end of the video there are some bonus questions as well. So the first one is we are looking at the superior cerebellar peduncle. Superior cerebellar peduncle. So under this we first look at the afferent fibers. So what are the afferent fibers? The afferent fibers, it includes the anterior. Afferent fibers includes the anterior spinocerebellar tract. So this is the afferent fibers. Next we look at the afferent fibers. So what are the afferent fibers? The afferent fibers, it includes the globus. It includes the globus, that is the emboliform as well as the rubral pathway. Next we look at the dentatothalamic. So the dentatothalamic pathway as well. So all this comes under the afferent. So next we move on to the middle. We move on to the middle cerebellar. So we move on to the middle cerebellar peduncle. So just to know that the middle cerebellar peduncle, it is nothing but it is the largest. It is the largest and it is the most lateral. It is the most lateral. As well as it is only afferent. Only afferent. So here, what is the afferent fibers? So in case of the middle cerebellar peduncle, the afferent fiber is nothing but the cortico. It is a cortico ponto cerebellar pathway. It is a cortico ponto cerebellar pathway. Next, we look at the inferior cerebellar peduncle. So what is the inferior cerebellar peduncle? So again we have the afferent and the efferent. So now looking at the afferent. So the afferent, it includes the posterior posterior spinocerebellar tract. Next, it also includes the cunicerebellar tract. Next, we also have the olivocerebellar tract. Then there is also the reticulocerebellar tract. And after this, there is also the trigemino cerebellar tract. And lastly, the inferior cerebellar peduncle. It also includes the vestibulocerebellar tract. Vestibulocerebellar tract. Then we look at what are the efferents. Afferent we saw, then the efferents. What is the efferent of the inferior cerebellar peduncle? So this includes the fastigial. So the fastigial vestibular. Next, it also includes the fastigial reticular. So fastigial reticular pathway. So now we jump on to the questions. So we asked a couple of questions. We'll be answering that. So we are just going to answer the questions. So the first question we asked was, what is the middle cerebellar peduncle? Middle cerebellar peduncle. So what we need to know is that it is the largest. These are some important points. So it is nothing but the largest, and it is most lateral. It is the most lateral, and it contains only the efferent. So the question we asked was, what is the efferent? So here is the answer. So the efferent is nothing but it is a corticopontocerebellar. It is a corticopontocerebellar pathway. Then we look at the next question we asked was, what is the inferior cerebellar peduncle? So the inferior cerebellar peduncle. So what is it? So the inferior cerebellar peduncle, it contains, there are some, we asked the efferents to be specific. So the efferents, it includes the fastigial. It includes the fastigial vestibular pathway. Next, it also includes the fastigial reticular pathway. So this much is over. Then we have the last question. The last question we asked is, in terms of the superior cerebellar, pathway, what are the efferent fibers? So in terms of superior cerebellar pathway, the efferent fibers, we have the globose. So there is the globose, that is the globose emboliform rubral pathway, and then there is also the dentathalamic pathway. So we also have the dentathalamic pathway. Now we have some bonus questions which you can answer it in the comment section. So the question is, so this is the bonus questions. So the first question we would like to ask is, in terms of the superior cerebellar peduncle. So in terms of the superior cerebellar peduncle, what is the afferent? What is the afferent fibers in terms of the superior cerebellar peduncle? The next question we want to ask is, what is the afferent fibers? What is the afferent fibers in terms of the inferior cerebellar peduncle? What are the afferent fibers? So you can answer them in the comment section.